15 of the country's most brilliant doctors stand helpless as a $12 billion empire hangs in the balance. Their patient is dying, and they have no idea why. But in the hallway outside, a 65-year-old black housekeeper named Martha Williams stands with tears streaming down her weathered face, knowing exactly what's killing him. "We've done everything we can," the lead physician announces to the gathered medical team. "Prepare the family for the worst." Martha can't take it anymore. She approaches the confused doctor, her voice trembling with desperation. "You need to check his left ankle again. Please, just trust me." The doctor barely glances at her. "Ma'am, we're medical professionals. We know what we're doing." Martha's voice cracks as she responds. "Then why is he dying when I know exactly what's wrong?" That moment right there? That's when everything changed. But to understand how a housekeeper could see what 15 doctors missed, we need to go back to where this incredible story really begins. Martha Williams wasn't always a housekeeper. 25 years ago, when she first walked through the massive oak doors of the Blackstone mansion, she carried with her dreams that had been shattered by circumstances beyond her control. You see, back in 1978, Martha was a pre-med student at Howard University. She was brilliant, determined, and had her entire future mapped out. But when her family faced financial ruin, Martha made the heart-wrenching decision to drop out and work to support them. The pain of that sacrifice never left her. But Martha didn't let bitterness consume her. Instead, she channeled her love for medicine into something else entirely. For 2.5 decades, she became the unofficial medical caretaker for the Blackstone family. Every scraped knee, every fever, every concern, Martha was there. She read medical journals in her spare time, studied symptoms, and developed an almost supernatural ability to spot what others missed. But Martha's medical intuition came with a devastating price. 15 years ago, her own son, Marcus, fell ill with symptoms that seemed minor at first. The doctors assured her it was just a stomach bug. Martha had a feeling something was wrong, but she trusted the professionals. She was, after all, just a housekeeper. Marcus died 3 days later from a misdiagnosed appendicitis that had ruptured. That loss changed Martha forever. She vowed never again to stay silent when she knew something was wrong, no matter who dismissed her. Now, about the man whose life hung in the balance that day. Richard Blackstone was not your typical billionaire. At 58 years old, he had built Blackstone Industries from absolutely nothing. Starting in a tiny garage with just $1,000 and a revolutionary idea for data storage, Richard had clawed his way to the top of the tech world. His empire was worth $12 billion, but success had cost him dearly. Richard was recently widowed. His wife Alina had died just 2 years earlier from cancer, leaving him devastated and alone. His 2 adult children had grown distant over the years, resentful of a father who had always put business first. The sprawling Blackstone mansion, once filled with laughter and family gatherings, had become a monument to loneliness. But there was one person who had always seen through Richard's tough exterior: Martha Williams. While most of the staff feared his demanding nature and quick temper, Martha understood that beneath the billionaire facade was a man carrying immense pain. Richard respected Martha in a way that surprised even him. She was the only person who dared to speak truthfully to him, and somehow that honesty had forged an unlikely bond between the tech mogul and his housekeeper. The only other person who had truly appreciated Martha's wisdom was Elena. Richard's late wife had often said that Martha knew the family better than they knew themselves. Elena would frequently seek Martha's advice on everything from household matters to personal concerns. When Elena was battling cancer, it was Martha who sat by her bedside during the long nights, offering comfort when the pain medication wasn't enough. After Elena's death, Richard had become even more isolated, throwing himself into his work with an almost manic intensity. Martha watched with growing concern as her employer pushed himself to dangerous limits, skipping meals, working 18-hour days, and ignoring his health entirely. Then came that Tuesday morning in October that would change everything. Richard was in the middle of the most important board meeting of his career. Blackstone Industries was about to announce a merger that would revolutionize the entire tech industry. The conference room on the 50th floor of the Blackstone Tower was filled with investors, lawyers, and executives worth hundreds of billions collectively. Richard was presenting the quarterly projections when it happened. Mid-sentence, he suddenly stopped talking. His face went pale, then flushed red. Sweat began pouring down his forehead as he gripped the edge of the mahogany conference table. "Sir, are you all right?" his assistant Jennifer asked from across the room. Richard tried to wave her off, but then a searing pain shot through his abdomen. He doubled over, gasping for breath. The room erupted in concerned voices as the most powerful man in the city collapsed to his knees, then fell unconscious on the polished marble floor. Within minutes, paramedics were racing him to Presbyterian Hospital, the city's most prestigious medical center. The symptoms were alarming: severe abdominal pain that had him writhing even in his unconscious state, a fever that spiked to dangerous levels, confusion when he briefly regained consciousness, and a heart rate that was climbing to frightening heights. Jennifer, Richard's assistant, knew there was one person who needed to be called immediately. With shaking hands, she dialed Martha's number. "Martha?" Jennifer's voice cracked through the phone. "You need to get to Presbyterian Hospital right now. Mr. Blackstone collapsed during the board meeting. It's bad, Martha. It's really bad." Martha dropped the phone and ran to her car, her heart pounding with the same terror she had felt 15 years ago when she got the call about Marcus. But this time, she told herself, this time would be different. If you're already gripped by this story and want to see how Martha's incredible medical intuition unfolds, make sure to hit that subscribe button and ring the notification bell, because what happens next will leave you speechless. As Martha raced through the city streets toward the hospital, one question haunted her thoughts. What could cause such sudden, severe symptoms in a man who had seemed perfectly healthy just hours before? What would you think if someone you cared about suddenly collapsed like this? Let me know your thoughts in the comments below. When Martha burst through the doors of Presbyterian Hospital, she entered what she thought would be a place of answers. Instead, she walked into a medical mystery that would baffle some of the most brilliant minds in the country for the next 36 hours. The team assembled to save Richard Blackstone's life read like a who's who of medical excellence. Leading the charge was Dr. Harrison Matthews, the chief of medicine at Presbyterian Hospital. At 55 years old, Matthews had built his reputation on being uncompromising, methodical, and absolutely certain of his medical judgment. He had graduated top of his class from Harvard Medical School, completed his residency at Johns Hopkins, and had been published in over 200 medical journals. To Dr. Matthews, medicine was a science, not an art, and he had little patience for anything that couldn't be proven with tests and data. But Dr. Matthews had one fatal flaw. His ego was as massive as his intellect. He had spent decades being right, and being right had made him arrogant. The idea that someone without medical training could offer valuable insight wasn't just unlikely to him, it was insulting. Working alongside Matthews was Dr. Sarah Chen, a brilliant internal medicine specialist who had earned her reputation as a diagnostic genius. At 38 years old, Chen could spot patterns in symptoms that others missed, and her ability to connect seemingly unrelated medical dots had saved countless lives. But on this particular day, Dr. Chen was dealing with her own crisis. She was working her third consecutive double shift, covering for colleagues who had called in sick during flu season. Her normally sharp mind was clouded by exhaustion, and the pressure of treating such a high-profile patient was weighing heavily on her shoulders. Michael Rodriguez brought 22 years of emergency medicine experience to Richard's case. Rodriguez had seen everything in his career: car accidents, heart attacks, mysterious poisonings, rare diseases that textbooks barely mentioned. He was calm under pressure and methodical in his approach, but Rodriguez was also a man who followed protocol to the letter. In emergency medicine, protocols existed for a reason, and deviating from established procedures could mean the difference between life and death. Unfortunately, Richard's condition didn't fit any protocol Rodriguez had ever encountered. The fourth member of this elite medical team was Dr. Amanda Foster, an infectious disease specialist who had been called in when Richard's symptoms suggested a possible systemic infection. Foster was thorough to a fault, the kind of doctor who would test for diseases so rare that most physicians had never seen a case. She approached each patient like a detective, solving a complex puzzle, methodically eliminating possibilities until she found the answer. But Foster's greatest strength was also her weakness. She could only solve puzzles when she had all the pieces. As Martha sat in the sterile waiting room, watching these four medical titans work to save the man who had become like family to her, she had no idea that she possessed the one crucial piece of information that could solve this deadly puzzle. Hour 2 arrived with what seemed like the first breakthrough. Richard's CT scan had come back, and Dr. Matthews strode into the waiting room with the confidence of a man who had found his answer. The good news, Matthews announced to the small group of Blackstone Industries executives who had gathered, is that we've ruled out appendicitis. The CT scan shows no inflammation in the appendix, no signs of rupture. We're looking at something else entirely. But Martha noticed something the doctors missed. When she was finally allowed to see Richard for a brief moment, she watched how he moved in the hospital bed. Even in his semi-conscious state, Richard was favoring his left side. It was subtle, the kind of detail you'd only notice if you'd been observing someone's habits for 25 years. Martha had seen Richard make that exact same subtle adjustment hundreds of times over the years, usually after long days on his feet or particularly stressful periods. When Martha tried to mention this observation to Dr. Matthews, his response was swift and dismissive. "Ma'am, I appreciate your concern, but we need to let the medical professionals handle this. The CT scan would have shown us anything significant about positioning or movement." Hour 6 brought another dead end. The possibility of kidney stones had been eliminated after additional imaging, but Richard's blood work was becoming increasingly abnormal. His white blood cell count was skyrocketing, suggesting his body was fighting some kind of infection, but the source remained a mystery. Dr. Chen pored over the lab results, her exhausted mind trying to piece together a diagnosis that made sense. Richard's symptoms were becoming more complex by the hour. The abdominal pain was intensifying, his fever was climbing despite aggressive cooling measures, and new symptoms were emerging that didn't fit any clear pattern. Martha approached Dr. Chen during a brief break, hoping that the younger doctor might be more receptive to her observations. "Doctor, I've been taking care of Mr. Blackstone for 25 years. I know his body better than anyone. There's something about his left leg that—" "Ma'am," Dr. Chen interrupted, though more gently than Matthews had, "I understand you're worried, but right now we need to focus on the immediate threat. We're dealing with what appears to be a serious systemic infection." Hour 12 marked a turning point, but not the kind anyone hoped for. Dr. Foster had arrived and immediately suspected sepsis, a life-threatening condition where the body's response to infection damages its own tissues and organs. The medical team launched into aggressive antibiotic treatment, pumping Richard full of the most powerful infection-fighting drugs in their arsenal. "We're treating this as septic shock," Foster explained to the gathered executives. "It's a serious condition, but we've caught it relatively early. The antibiotics should start showing results within the next few hours." But Martha knew something was wrong. She had spent years caring for Elena during her cancer treatments, learning about different medications and their effects. She had watched Richard's late wife go through countless rounds of antibiotics, and she knew how the body typically responded. What she was seeing in Richard didn't match that pattern. During her next brief visit to Richard's bedside, Martha noticed something else that made her stomach drop. Richard's left ankle was slightly swollen. It was barely noticeable, the kind of detail that busy medical staff rushing between multiple patients might easily miss. But Martha remembered something from months earlier, a conversation she'd had with Richard about his old football injury. When Martha tried to bring this up with Dr. Rodriguez, his response was professional but firm. "Ma'am, we appreciate your dedication to Mr. Blackstone, but ankle swelling can be a symptom of the heart complications we're already monitoring. We have everything under control." Hour 18 brought the heart complications Dr. Rodriguez had mentioned, but they were far worse than anyone had anticipated. Richard's cardiovascular system was beginning to fail, his heart struggling to pump blood effectively throughout his body. A cardiologist was rushed in, adding another layer of complexity to an already overwhelming case. Martha sat in the waiting room, watching doctors rush in and out of Richard's room with increasing urgency. Each new specialist brought hope, but also brought new questions. How could a healthy 58-year-old man deteriorate so rapidly? What kind of infection could cause such widespread systemic damage? But Martha wasn't thinking about infections. She was thinking about a conversation she'd had with Richard just 6 months earlier. He had been limping slightly after a long day at the office, and when she'd asked about it, he'd mentioned that his old football injury was acting up again. "You know, Martha," Richard had said, rubbing his left ankle, "sometimes I think this old injury knows when bad weather is coming better than any meteorologist." That memory haunted Martha as she watched the medical team struggle to save Richard's life. She tried once more to approach Dr. Matthews with her concerns. "Doctor, please, I know this sounds crazy, but you need to look at his left ankle. He had an injury there years ago." "And, ma'am," Matthews interrupted, his patience clearly wearing thin, "I need you to understand something. We have some of the best medical minds in the country working on this case. We're using the most advanced diagnostic equipment available. Your observations, while well-intentioned, are not going to help us here." Hour 24 brought devastating news. Richard's liver function was declining rapidly. The infection, whatever it was, had spread throughout his system and was now attacking multiple organs simultaneously. A hepatologist joined the growing team of specialists, each one bringing their own expertise, but also their own confusion. Dr. Foster was beginning to question her initial diagnosis. The sepsis treatment should have shown some improvement by now, but Richard was getting worse, not better. His body was fighting something, but they still couldn't identify what. Martha's desperation was reaching a breaking point. She had lost her son to medical professionals who wouldn't listen, and now she was watching the same tragedy unfold again. During another brief visit to Richard's bedside, she noticed that the swelling in his left ankle had increased. It was still subtle, but to Martha's trained eye, it was obvious. She tried approaching Dr. Chen again, hoping that exhaustion might make the younger doctor more receptive to outside input. "Dr. Chen, I know you're tired, and I know you're doing everything you can, but please, just for a moment, look at his left ankle. Really look at it." Dr. Chen barely glanced up from the chart she was reviewing. "Ma'am, please let us do our job. We know what we're doing." Hour 30 brought the emergence of neurological symptoms. Richard was becoming increasingly confused during his brief moments of consciousness. His speech was slurred, and his responses were delayed. A neurologist was called in, expanding the medical team to 6 specialists, each one more baffled than the last. The neurological symptoms suggested that the infection, whatever it was, had possibly crossed the blood-brain barrier. This was the kind of development that turns serious cases into life-threatening emergencies. Martha watched from the hallway as the neurologist examined Richard, testing his reflexes, checking his pupils, assessing his cognitive function. But she noticed something the neurologist missed. When the doctor tested Richard's reflexes, his left leg responded differently than his right. The difference was subtle, but it was there. Martha's medical knowledge, accumulated over decades of caring for the Blackstone family and supplemented by her own research after Marcus's death, told her that this wasn't about the brain. This was about circulation, about pressure, about something that was affecting blood flow to Richard's extremities. She made one more desperate attempt to get the medical team's attention. "Please," she begged Dr. Matthews, "just examine his left leg thoroughly. Not just a quick check. Really examine it. I'm telling you, there's something wrong there." Dr. Matthews barely looked at her. "Ma'am, I'm going to have to ask you to stop interfering with our work. We're dealing with a complex neurological emergency here." Hour 36 brought the news that Martha had been dreading. Multiple organ failure was beginning. Richard's kidneys were shutting down, his liver was barely functioning, his heart was struggling, and now his brain was showing signs of oxygen deprivation. The medical team was running out of options, and they were running out of time. As Martha stood in that sterile hospital hallway, tears streaming down her face, watching 15 of the most educated, experienced, and talented doctors in the city struggle helplessly to save the life of a man she had cared for like family, she made a decision that would change everything. She was done being polite. She was done being dismissed. She was done watching medical professionals miss what seemed obvious to her. Martha Williams, the 65-year-old housekeeper who had dropped out of pre-med school 47 years earlier, was about to challenge the entire medical establishment. And in doing so, she was about to save a billionaire's life by noticing the one thing that 15 brilliant doctors had missed. But first, she needed to find one doctor, just one, who would be willing to listen to what she had to say. What happened next would prove that sometimes the most important medical breakthroughs come not from advanced technology or years of medical training, but from the simple act of truly observing someone you care about. It was during Martha's evening visit to Richard's bedside that she noticed something that would change everything. Richard was sleeping fitfully, his body fighting the mysterious illness that had baffled 15 specialists. But even in his unconscious state, Martha watched as Richard's left hand drifted down to his ankle. His fingers found that familiar spot just above his left ankle bone, and he began rubbing it in slow, unconscious circles. Martha's breath caught in her throat. She had seen Richard make that exact same gesture thousands of times over the past 25 years. It was as automatic as breathing for him. Whenever he was stressed, tired, or in pain, Richard's hand would unconsciously drift to that old injury site. But watching him do it now, while fighting for his life, triggered a cascade of memories that would finally provide the answer everyone had been searching for. 6 months earlier, Martha had found Richard in his study, rubbing that same spot after a particularly long day of meetings. When she'd brought him his evening tea, she'd noticed him grimacing slightly as he adjusted his position in his leather chair. "Mr. Blackstone, is your leg bothering you again?" Martha had asked with the concern of someone who had watched over him for decades. Richard had looked up with that tired smile that had become more common since Elena's death. "You know me too well, Martha. This old football injury just doesn't want to let me forget about it. Some days I swear it knows when bad weather is coming." But then Richard had said something that Martha hadn't thought about until this very moment, something that now seemed incredibly significant. "You know what's funny, Martha? The doctors always told me I was lucky that the surgery went so well when I was a kid. Elena used to call it my lucky scar because it reminded her that I'd survived worse things than boardroom battles." Surgery. As a child, on his left ankle, Martha's mind began racing, connecting dots that the medical team had missed because they were focused on Richard's abdominal symptoms and systemic infection. She thought about Elena's words about the lucky scar and began to remember other conversations, other small details that had seemed insignificant at the time. Just 3 weeks ago, Richard had mentioned a minor accident in the garage. He'd been moving some storage boxes when a metal edge had scraped his ankle. Martha had offered to clean and bandage the small wound, but Richard had waved her off, saying it was just a scratch and would heal on its own. But what if it hadn't healed properly? What if that small puncture wound, right at the site of his old surgical scar, had become infected? And what if that infection was trapped in a confined space, building pressure and poisoning his entire system? Martha's pre-med training, though decades old, suddenly came flooding back. She remembered learning about compartment syndrome, a condition where pressure builds up in enclosed muscle compartments, cutting off blood flow and causing tissue death. If the infection had spread to the deep compartments of Richard's lower leg, it could explain everything: the systemic infection, the multiple organ failure, the neurological symptoms. Her heart was pounding as the pieces fell into place. This wasn't about his abdomen at all. This was about a localized infection that had gone systemic because pressure was preventing proper blood flow and allowing toxins to build up in his system. Martha knew she had to act fast. Richard was dying, and she was the only person who understood why. But who would listen to her? Dr. Matthews had made it clear that her input wasn't welcome. Dr. Rodriguez followed protocol religiously, and this theory would require him to deviate from standard sepsis treatment. Dr. Foster was thorough, but she was looking for exotic infections, not simple wound complications. That left Dr. Chen. Martha waited in the hallway until she saw Dr. Chen emerging from another patient's room. The younger doctor looked exhausted, her usually perfect hair pulled back in a messy ponytail, her scrubs wrinkled from the long shift. But there was something about Dr. Chen that gave Martha hope, a kindness in her eyes that the other doctors seemed to lack. Martha approached carefully, knowing this might be her only chance. "Dr. Chen, I know you're tired, and I know you probably think I'm just a worried family friend who's getting in the way. But I need you to listen to me for just 2 minutes. What I'm about to tell you could save Mr. Blackstone's life." Dr. Chen paused, her hand on the door to the next patient's room. Something in Martha's voice, a certainty, a desperation, a knowledge that seemed to come from somewhere deeper than casual observation, made her stop. "Ma'am, I really don't have time right now. We're dealing with a very complex case, and—" "Compartment syndrome," Martha interrupted. "In his left leg, that's what's killing him." Dr. Chen turned around slowly. "What did you just say?" "Mr. Blackstone has compartment syndrome in his left lower leg, secondary to an infected wound at an old surgical site. The pressure is causing systemic septic shock by preventing proper circulation and allowing toxins to build up in the tissue." Dr. Chen stared at Martha in shock. This wasn't the rambling of a worried housekeeper. This was medical terminology, precise and specific. "How do you know about compartment syndrome?" Dr. Chen asked, her exhaustion momentarily forgotten. Martha took a deep breath. It was time to reveal everything. "Because I was a pre-med student at Howard University before financial circumstances forced me to drop out in 1978. Because I've spent the last 25 years caring for this family and learning everything I could about medicine to make sure I never missed something important again, and because 15 years ago I lost my son Marcus to a misdiagnosed appendicitis, while doctors who wouldn't listen to me assured me that everything was fine." The hallway fell silent, except for the distant beeping of monitors and the soft hum of the hospital's ventilation system. Dr. Chen was studying Martha with new eyes, seeing not a housekeeper who was overstepping her bounds, but a woman with medical knowledge and a tragic history that had taught her to trust her instincts. "Tell me everything you've observed," Dr. Chen said quietly. Martha felt a surge of hope. Finally, someone was listening. 3 weeks ago, Mr. Blackstone scraped his left ankle on a metal edge while moving boxes in his garage. It was right at the site of a childhood surgical scar. He had surgery there as a child after a football injury. He told me not to worry about it, said it was just a scratch. But I've been watching him for 25 years and I know his habits. Even unconscious, he rubs that ankle when he's in distress. The way he positions his body, the subtle favoring of his left side, it's all pointing to something wrong with that leg." Dr. Chen was listening intently now, her medical mind processing Martha's observations. "But the CT scans," Dr. Chen said, "they would have shown significant swelling or infection in the leg." "Would they?" Martha asked. "If you were looking for abdominal pathology and systemic infection? If the swelling was moderate and the infection was deep in the muscle compartments?" "Dr. Chen, when was the last time anyone actually examined his left ankle thoroughly?" The question hung in the air like an accusation. Dr. Chen realized that in 36 hours of intensive medical care, with teams of specialists examining every system in Richard's body, no one had paid close attention to his extremities. They had been so focused on the dramatic abdominal symptoms and systemic infection that they had missed something basic. "If you're right," Dr. Chen said slowly, "and I'm not saying you are, but if you're right, he would need immediate surgical intervention. Compartment syndrome can cause permanent tissue death and systemic toxicity if not treated quickly." "He's been fighting this for 36 hours, Martha replied. "How much time do you think he has left?" Dr. Chen made a decision that would save Richard's life and end her career at Presbyterian Hospital if she was wrong. "I'm going to examine his ankle," she said. "Dr. Matthews specifically ordered that we focus on systemic treatment and not get distracted by peripheral concerns, but—" "Dr. Chen," Martha interrupted, "what's more important, following Dr. Matthews' orders or saving Mr. Blackstone's life?" It was a question that cut straight to the heart of why Dr. Chen had become a doctor in the first place. Without another word, Dr. Chen turned and walked back toward Richard's room, with Martha following close behind. What they discovered would vindicate Martha's theory and expose a medical oversight that nearly cost a billionaire his life. Dr. Chen carefully pulled back the hospital blanket and examined Richard's left ankle for the first time since his admission. What she saw made her stomach drop. The ankle was significantly swollen, nearly twice the size of his right ankle. The skin was tight and discolored, with an angry red streak running up his lower leg. And there, just above the ankle bone, was a small puncture wound that had been overlooked because it was covered by the surgical scar tissue from his childhood operation. "Oh my God," Dr. Chen whispered. "You're right." But the most damning evidence came when Dr. Chen gently pressed on the swollen tissue. Richard, even in his semi-conscious state, moaned in pain and tried to pull his leg away. The tissue was rock hard, indicating massive pressure buildup in the muscle compartments. "This is acute compartment syndrome with secondary systemic infection," Dr. Chen said, her voice filled with a mixture of awe and horror. The puncture wound became infected, the infection spread to the deep muscle compartments, and the pressure buildup has been preventing proper circulation for weeks. The toxins from the dying tissue have been poisoning his entire system. Martha felt tears streaming down her face, but they were tears of relief, not despair. "Can you save him?" she asked. Dr. Chen was already reaching for her phone to call the surgical team. "We're going to try," she said. "But Martha, I need you to understand something. This requires immediate emergency surgery. We need to perform a fasciotomy to relieve the pressure and debride all the infected tissue. If we're too late, if too much tissue has already died, he could lose his leg. Or worse." Martha nodded, understanding the gravity of the situation. "Doctor, he's been dying for 36 hours while 15 specialists tried to figure out what was wrong. Whatever happens now has to be better than what was happening before." Chen made the call that would send Richard into emergency surgery and would force the entire medical team at Presbyterian Hospital to confront their own assumptions about expertise, experience, and the value of truly listening to those who care most about our patients. As the surgical team mobilized and Richard was rushed toward the operating room, Martha stood in the hallway, finally feeling like she had done everything she could to prevent another tragedy, like the one that had taken her son. But the next few hours would determine whether her medical intuition and persistent advocacy had been enough to save the life of the man who had become like family to her. What happened next was 3 minutes and 27 seconds of pure medical chaos that would determine whether a billionaire lived or died based on the observations of a housekeeper who refused to give up. The emergency call for a surgical team echoed through the halls of Presbyterian Hospital at exactly 11:43 p.m. Dr. Chen's urgent voice over the intercom cut through the usual nighttime quiet. "Emergency fasciotomy needed in OR3. Acute compartment syndrome with systemic sepsis. Patient is Richard Blackstone. I repeat, this is a life-threatening emergency." Within minutes, the surgical team was assembling, but so was a storm of medical politics that threatened to derail Richard's last chance at survival. Dr. Harrison Matthews arrived at the operating room in a fury that Martha could hear from down the hallway. His voice, usually controlled and professional, was raised in anger as he confronted Dr. Chen outside the surgical suite. "Dr. Chen, what the hell do you think you're doing? I specifically ordered that we maintain systemic treatment protocols. This patient is in multiple organ failure, and you want to perform exploratory surgery on his ankle based on the observations of a housekeeper?" Dr. Chen stood her ground, but Martha could see her hands shaking as she tried to explain her findings. "Dr. Matthews, I examined the patient myself. There's clear evidence of compartment syndrome. The ankle is severely swollen, there's an infected puncture wound at an old surgical site, and you've potentially wasted precious time chasing a dead-end theory while this man dies of septic shock," Matthews interrupted. "Do you have any idea what kind of liability we're facing if we perform unnecessary surgery on a patient in this condition?" But then something happened that changed everything. Richard's monitor, which had been showing concerning but stable vitals, suddenly erupted in alarms. His blood pressure was plummeting, his heart rate was becoming erratic, and his oxygen saturation was dropping to dangerous levels. "He's crashing," shouted the ICU nurse who had been monitoring his vitals. "BP is 60/30 and falling. Heart rate is 140 and climbing." Dr. Chen looked at Dr. Matthews with desperation in her eyes. "We're out of time. If I'm right about the compartment syndrome, this crash is because the pressure and toxins have reached a critical level. Surgery is his only chance." Dr. Matthews faced an impossible decision: proceed with an unproven surgical intervention that could kill a patient who was already dying, or continue with systemic treatment that had already failed for 36 hours. The monitors continued their terrifying symphony of alarms as Richard's body began shutting down before their eyes. "Fine," Matthews said through gritted teeth. "But if this patient dies on the field because of this wild theory, it's on your head, Dr. Chen." As the surgical team rushed to prepare for emergency surgery, Martha found herself banished to the hallway outside the operating room. Through the small windows in the OR doors, she could see the controlled chaos of medical professionals working to save Richard's life, based on her observations. But Martha wasn't just watching. She was praying with an intensity she hadn't felt since the night she lost Marcus 15 years ago. Every prayer was the same: "Please God, let me be right. Let this save him. Don't let me watch another person die because of something I should have spoken up about sooner." Inside the operating room, the surgical team was working against time and Richard's failing body. Dr. Rodriguez, the emergency medicine specialist, was managing Richard's cardiovascular collapse while the surgical team prepped for the fasciotomy. Richard's blood pressure was so low that they had to use powerful medications just to maintain enough circulation to keep him alive during the procedure. "Pressure's dropping again," called out the anesthesiologist. "We're losing him." Dr. Chen, now serving as the lead surgeon for a procedure she hadn't performed since her residency, made the first incision along Richard's lower left leg. What happened next would either vindicate Martha's theory or prove that they had wasted Richard's final moments on a desperate gamble. The moment Dr. Chen's scalpel cut through the fascia, the tough membranes surrounding the muscle compartments, the operating room fell silent, except for the steady beep of monitors. What they saw was unlike anything most of them had ever witnessed. Dark, infected fluid immediately began pouring from the incision site. The pressure that had been building in Richard's leg compartment for weeks was finally being released, and the smell of the infection was so overwhelming that several team members had to step back from the table. "My God," whispered Dr. Rodriguez. "Look at the muscle tissue." The muscle in Richard's lower leg was a sickly gray-black color, clearly showing signs of tissue death from the prolonged pressure and infection. But more importantly, as Dr. Chen continued to open the compartment, they could see the source of the systemic infection that had nearly killed him. The small puncture wound that Richard had dismissed as just a scratch had created a direct pathway for bacteria to enter the deep muscle compartments of his leg. The infection had been festering there for 3 weeks, trapped by the tight fascia and unable to drain properly. Pressure had built up so much that it was cutting off blood flow, causing tissue death and allowing toxins to leak into Richard's bloodstream. "This explains everything," Dr. Chen said, as she worked to drain the infection and remove the dead tissue. "The systemic sepsis, the multiple organ failure, the neurological symptoms. It's all secondary to this localized infection that we missed because we were looking in the wrong place." But the real moment of triumph came when they looked at Richard's monitors. As Dr. Chen drained the infected fluid and relieved the pressure in his leg, Richard's vital signs began to stabilize. His blood pressure started to climb back toward normal ranges. His heart rate became more regular. His oxygen saturation improved. "It's working," said the anesthesiologist with amazement in his voice. "His pressure's coming up, heart rate's stabilizing." Dr. Matthews, who had been watching the procedure with skeptical concern, found himself staring at the monitors in disbelief. After 36 hours of aggressive medical treatment with the most advanced protocols available, Richard's condition was finally improving because they had performed a relatively simple surgical procedure based on the observations of a housekeeper. Continue the debridement, Matthews said quietly, his earlier anger replaced by professional focus. Remove all the necrotic tissue and irrigate thoroughly. We need to make sure we get all of the infection. For the next hour, the surgical team worked meticulously to clean out Richard's leg compartment, removing dead tissue and flushing out the remaining infection. With each minute that passed, Richard's vital signs continued to improve. His body, finally free from the toxins that had been poisoning his system, began the process of healing. Outside in the hallway, Martha watched through the operating room windows as the frantic activity inside gradually became more controlled and methodical. She couldn't hear what was being said, but she could see the change in body language among the surgical team. The desperate urgency had been replaced by focused, careful work. And then at 1:17 a.m., after nearly 40 hours of medical crisis, Martha saw something that made her fall to her knees in the hospital hallway. Dr. Chen emerged from the operating room, pulling off her surgical mask with an expression of exhausted relief. She walked directly to Martha, who was still kneeling on the cold linoleum floor. "Martha," Dr. Chen said, her voice hoarse from the long night, "you saved his life. You were absolutely right. Compartment syndrome with secondary systemic infection. We drained over 200 milliliters of infected fluid from his leg compartment. His vitals are stable, his organ function is already beginning to improve, and barring any complications, he's going to make a full recovery." Martha looked up at Dr. Chen with tears streaming down her face. "He's really going to be okay?" "He's going to be okay," Dr. Chen confirmed. "And Martha, I need you to understand something. What you did tonight, your observations, your persistence, your medical knowledge, that's what saved him. 15 specialists with decades of training missed what you saw because you knew him as a person, not just as a collection of symptoms." As Martha stood up on shaking legs, she felt a weight lifting from her shoulders that she had been carrying for 15 years. This time, she had spoken up. This time, someone had listened. This time, she had been able to prevent a tragedy instead of just watching it unfold. Richard Blackstone, the $12 billion tech mogul, was alive because his housekeeper had refused to accept that 15 doctors knew better than someone who had been observing him with love and attention for 25 years. But it's not over yet. Richard's recovery would bring revelations, gratitude, and life-changing opportunities that neither he nor Martha could have imagined when this medical crisis began. 3 days later, when Richard Blackstone opened his eyes in the intensive care unit of Presbyterian Hospital, the first words out of his mouth would change Martha Williams' life forever. The morning sun was streaming through the hospital windows when Richard finally emerged from the medically induced coma that had been necessary during his recovery. His leg was heavily bandaged from the fasciotomy surgery, but his vital signs were strong, his infection markers were dropping, and his organ function had returned to normal levels. The ICU nurse immediately called for Dr. Chen, who rushed to Richard's bedside to assess his neurological function and overall condition. Richard's eyes focused slowly, taking in the familiar surroundings of the hospital room, the monitors, the IV lines, and the concerned face of Dr. Chen looking down at him. "Mr. Blackstone, can you hear me? Do you know where you are?" Dr. Chen asked, checking his pupils with a small flashlight. Richard's voice was hoarse from the breathing tube, but his words were clear and determined. "I'm in the hospital, and I need to see Martha Williams immediately." Not his children, who had been called and were flying in from across the country. Not his business associates, who had been desperately trying to manage Blackstone Industries during his illness. Not even his personal physician. The first person Richard Blackstone wanted to see was the 65-year-old housekeeper who had saved his life. When Martha walked into Richard's room 20 minutes later, the emotional weight of the past week finally hit both of them. Richard, this powerful billionaire who commanded boardrooms and made decisions that affected thousands of employees, looked up at Martha with tears in his eyes. "Martha," he said, his voice breaking with emotion, "Dr. Chen told me everything. You saved my life. For 36 hours, 15 of the best doctors in the city couldn't figure out what was wrong with me. But you knew. You fought for me when I couldn't fight for myself." Martha approached his bedside, her own eyes filling with tears. Mr. Blackstone, I just couldn't bear to lose someone else when I knew something was wrong. I've been taking care of you for 25 years. I know your body, I know your habits, and I knew that what they were treating wasn't what was killing you. Richard reached out and took Martha's hand, a gesture that surprised them both with its intimacy and sincerity. Martha, I need you to understand something. What you did wasn't just about medical knowledge or careful observation. What you did was about love. You cared enough to keep pushing when everyone else wanted you to be quiet. You cared enough to risk being seen as a nuisance, as someone overstepping her bounds, because you knew I was dying and you had the answer. The conversation that followed would transform both of their lives in ways neither could have predicted. Martha? Richard continued. Dr. Chen told me about your background. She told me that you were pre-med at Howard University before you had to drop out. She told me about your son Marcus, and about how losing him taught you never to stay silent when you know something is medically wrong. Martha nodded, unable to speak as decades of buried pain and regret surfaced. I also know, Richard said, that you've spent 25 years in my house, watching over my family, learning everything you could about medicine, and never getting the chance to use that knowledge to help people the way you always wanted to. Richard paused, gathering his strength for what he was about to say next. Martha, I'm establishing a medical scholarship fund in your name at Howard University. The Martha Williams Medical Scholarship will provide full funding for students who have faced financial hardship but demonstrate exceptional dedication to patient care. But more than that, I want you to oversee this program. I want you to interview candidates, mentor students, and make sure that the next generation of doctors understands that caring for patients means listening to everyone who has something valuable to contribute. Martha stared at Richard in shock. Mr. Blackstone, I don't understand. Are you offering me a job? I'm offering you a calling, Richard replied. I'm offering you the chance to pursue your dream of helping people medically, but in a way that honors everything you've learned about the importance of observation, persistence, and truly caring about patients as human beings. The scholarship announcement was just the beginning. Within a week of Richard's recovery, the story of how a housekeeper had diagnosed what 15 specialists missed had spread throughout Presbyterian Hospital and beyond. The medical community was forced to confront some uncomfortable truths about expertise, hierarchy, and the value of listening to those who spend the most time with patients. Dr. Harrison Matthews found himself facing a formal review by the hospital's medical board. The investigation wasn't just about his dismissal of Martha's observations, but about a pattern of behavior that prioritized medical hierarchy over patient care. The review concluded that Matthews' arrogance and unwillingness to consider input from non-medical personnel had nearly cost a patient his life. Matthews was ultimately demoted from chief of medicine and required to complete additional training in patient advocacy and collaborative care. The review board's report stated that expertise without humility is not medicine, it's ego masquerading as science. But the changes at Presbyterian Hospital went far beyond one doctor's career consequences. The hospital implemented a new protocol requiring medical teams to actively seek input from family members, caregivers, and anyone who had significant knowledge of a patient's medical history and behavior patterns. They called it the Martha Williams Protocol, and it became a model that other hospitals across the country began adopting. The protocol required doctors to document any concerns raised by non-medical personnel and to provide written justification if they chose not to investigate those concerns. It created a formal pathway for people like Martha to have their observations heard and taken seriously. 6 months after Richard's recovery, Martha Williams began her new role as patient advocate and scholarship coordinator at Presbyterian Hospital. Her office was just down the hall from the emergency department, and her door was always open to families and caregivers who felt that their concerns weren't being heard. But perhaps the most meaningful part of Martha's new position was her work with medical students. Every month, she would meet with first-year students to share her story and teach them about the importance of listening to patients and their families. Medicine isn't just about what you can measure with tests and machines. Martha would tell these young future doctors. Medicine is about understanding that every patient is a whole person with a history, with habits, with people who love them and know them better than any doctor ever will. Your job isn't just to treat symptoms. Your job is to listen to the full story of who this person is and what might be affecting their health. The students would sit transfixed as Martha told them about Richard's case, about how 15 brilliant doctors missed a diagnosis that became obvious once someone looked at the whole person instead of just the test results. The most important question you can ask, Martha would conclude, isn't what did the tests show? The most important question is, what am I missing, and who might know the answer? 1 year after his near-death experience, Richard Blackstone stood in the auditorium of Howard University's medical school as the first class of Martha Williams scholars was announced. 25 students who had overcome financial hardship, family tragedy, or educational obstacles were receiving full scholarships to pursue their medical dreams. As Martha watched these young students accept their scholarships, she thought about her son, Marcus, about all the years she had spent caring for others while her own medical dreams seemed impossible, and about how sometimes the most devastating experiences in our lives can lead to the most meaningful contributions we ever make. Richard spoke to the crowd that day about how Martha had saved his life, but not just in the medical sense. She had saved his life by reminding him that wisdom comes in many forms, that expertise without compassion is hollow, and that sometimes the most important voice in the room is the one that everyone else is ignoring. Martha Williams taught me that true healing happens when we listen to those who care most, Richard said. She taught me that love and careful attention can be just as powerful as any medical technology. And she taught me that sometimes a housekeeper can see what a team of specialists cannot. Not because she knows more medicine, but because she knows more about what it means to truly care for another human being. As the ceremony concluded and the new medical students began their journeys toward becoming doctors, Martha Williams stood among them, finally pursuing her dream of helping others heal, but in a way that honored everything she had learned about the power of persistence, observation, and refusing to stay silent when you know something is wrong. The story of how a housekeeper saved a billionaire's life became more than just a medical miracle. It became a reminder that wisdom and experience come in many forms, that sometimes the most important voice is the quietest one, and that true healing happens when we listen to those who care most about the outcome. Martha Williams had spent 25 years as a housekeeper, but she had always been a healer. It just took a medical crisis and a billionaire's near-death experience for the world to finally recognize what she had always known about herself. If this story of persistence, compassion, and never giving up on what you know is right has moved you, make sure to subscribe and hit that notification bell, because there are so many more incredible stories of ordinary people doing extraordinary things that you won't want to miss. What would you have done in Martha's situation? Would you have kept pushing when 15 doctors told you to be quiet, or would you have stepped back and trusted the experts? Share your thoughts in the comments below, because your perspective on standing up for what you believe is right could inspire someone else who's facing their own impossible situation.